topics and stuff like that.
All right, guys, welcome back. Well, this afternoon, we're hoping to educate you about diabetes. This afternoon, Dr. Jeffrey Davidson joins us from Columbia Clinic, and he and I were talking in the commercial break. Obviously, lots of people, unfortunately, are familiar with diabetes, but for those who think they might know everything, let's just clear some things up for them. Obviously, first and foremost, there are two types of diabetes. Can you talk about those if you can?
There's actually three types.
Oh, okay.
There's type 1,
Right.
which accounts for about 10% of the diabetics out there. That's going to be the ones that are more insulin dependent. You may know that as insulin dependent diabetics. Then there's type 2, which is non-insulin dependent. That affects the vast majority of diabetics, the rest of them. And then there's also gestational diabetes.
Yes.
As you know, for pregnant women that usually return to normal after they deliver. But type 1 is a genetic. Type 1 is it's a genetic disease from the beginning, from the get-go. Type 2 has some genetic links, but it's not considered necessarily a genetic
It's something that
link.
you kind of develop.
It's something you develop, and you can definitely affect it with diet, exercise. Of course, that can affect all types of diabetes.
And
But
same thing with gestational. That's
Same
about
thing with gestational.
Diet and activity.
it's always going to be diet and activity.
Right, you're correct. You're correct.
And then sometimes insulin if it's necessary.
So we were just talking also about some of the complications that can arise. If you're insulin dependent, obviously you don't have a choice. Every single day you have to take that insulin, sometimes multiple times a day. But for the other two types, what kind of complications can we run into?
Well, for all types, type 1 and type 2, basically, you're looking at all kinds of health-related issues. It can affect just about every system of the body.
Wow.
Cardiac, nervous system, retinopathy, blindness in the eyes, kidney disease, nephropathy, neuropathy, poor circulation. There's a lot to be, said for diabetic control.
So if people are at home right now and they maybe have gone to the doctor and been kind of in that range, close to being in the diabetic range, what can they do right now to try to start changing some of those things or keep themselves from going over that line, if you will?
Well, first of all, make sure you've got a good doctor to follow up with and they stay on top of it. You want someone who's going to be interested in getting your numbers where they need to be.
Right.
And, I would say that the average for sugars you're trying to get, A1Cs are probably one of the most important numbers in diabetics that people don't realize, but A1Cs less than 7% are always going to be the recommendation of your primary doctors and as well as your endocrinologist and the American Diabetic Association.
So you have about 30 seconds left. I know you wanted to talk about the Alabaster, is it the health fair, right, in Alabaster?
Alabaster Health Fair is going to be on August 10th,
okay,
this Saturday. It's from 10 to 2, I believe.
And there will be screenings for diabetes there, so people can, if they have any questions about that, that's a great time to get that.
A lot of kids' activities, a lot of different types of medical specialties will be represented, so it should be a lot of fun. All
right, and lastly, give us your contact information if people want to find out more information about diabetes.
Our contact information is the Columbiana Clinic, and we are 205-669-31380, Columbiana.
All right, well, thanks so much, doctor. We appreciate your time.
Thank you.